just wanna have fun, clap my hands, turn around now and dance, dance, dance. I just wanna have fun, clap my hands, turn around now and dance, dance, dance. I just wanna have fun, clap my hands, turn around now and dance, dance, dance. I just wanna have fun, clap my hands, turn around now and dance, dance, dance. I just wanna have fun, clap my hands, turn around now and dance, dance, dance. I just wanna have fun.
You guys look amazing. I love the energy. You know, when I was doing this, I felt that girl going. Thank you, man. Right, let's do our ritual. Stand up. We've got limited time, and I want you guys to be able to ask as many questions as we can answer. I'm Dr. Zenda. I'm Dr. Gynae. I'm a girl. I love girls in the said famous girl. I love women's health. And the one thing that in partnership with Clicks we always want is you spend less money at your doctors and more money taking care of yourselves. Yay? Let's stand up. Let's greet the girl. Come stand up. Cross your legs like this for me. Right. If you need to concentrate, you can close your eyes. Let's say hello, girl. I saw some guys though. Okay, if you're a guy and you're in here, you can be like, hello, my guy. Right. Let's say hello, girl. Feel her. Cross her legs tight, tight, tight. Feel her right up there. Yeah. Say hello, girl. Say, girl, you're amazing. I'm sorry for all the panty liners and the douching and the pineapple and the yogurt I've been putting on you. You can take a seat, please. I love starting like that because a lot of us have grown up in a society, in a culture where we are taught to maybe love every part of us, but when it comes to our reproductive and sexual health, it's a shame, it's something we're supposed to be hiding, and no more hiding, right? Yes. So, as I have been tasked by my beautiful family from Clicks, we want to talk. It's going to be a very quick one, and I'm going to touch on as much as possible on the phases of a woman. How many of us have got daughters? Anybody who's a parent? Great. How many of us are still wanting to fall pregnant and have kids? No, not me. How many of us are crossing over to the perimenopause, menopause? I'm a 40-something. Anybody above 50? Right? So all these changes are constantly happening to our bodies. The most important thing, whenever you're thinking about your sexual health, even just going to a gynae can feel very uncomfortable, scary, and some of us don't even go to get our screenings. One of the most important things in how you pick your clinician or a healthcare provider or a healthcare facility, Clicks has plenty of these clinics where you've got amazing nurses. I work as a gynecologist in the area of Johannesburg, but the one thing that you always want with your healthcare provider or facility is somebody who sees you, yeah? Is somebody who understands you. It must feel like you're going to a spa or like to have a chat with your girlfriend because it can be uncomfortable. So what are some of the important topics that we should be having conversations about with our gynaes? The 3 phases of a woman: you get puberty, you get reproductive, and you get sort of like your tail end or your golden years, which is your menopause. Menstrual health becomes really important. And like I said earlier on, unfortunately, our society, very often, we have to hide these things. When you think of menstruation from a teen perspective, I've got a 14-year-old, and one of the things that they struggle with a lot is irregular periods. So if your period is not happening in a cycle, 21 to 35 days is a normal cycle of a woman. But for teens, especially if they're playing sports and they're active, you will find that they might be skipping periods, right? So that's okay. If you're concerned, please take your girl to see a gynae, right? For menstruation, when you are sort of like in your reproductive age, things that often bother us is you'll find people saying, oh no, I've been bleeding for more than 2 weeks and I didn't go see a doctor. How, right? You should never bleed more than 7 days, right? 7 days. And when you think of your cycle, remember I said 21 to 35 days, that means there's no such a thing as a monthly period. We're learning, right? It's a conversation. Talk to me, right? So there's no such a thing as a monthly period, really, because months end, 30th, amanye 31st, amanye 28th. What happens if you are a 25-day cycle girl? It means at some point you are likely to have a period twice a month. What happens if you are a 34-day kind of girl? It means sometimes you will skip a month, and so rather use the cycle rather than saying it's a monthly period. We happy there? Right. And then the other reason that in terms of menstruation, so you get the heavy bleeding. What do you describe as heavy bleeding? Anyone? Blood clots? Anyone else? Nausea? High volumes of blood? What do people normally do when they've got high volumes of blood? We change often, or we double. It's a tampon and the pad and the stofie and the tights and the panty, right? If you are having to change your sanitary product, be it a tampon or a pad, you should never have to double up, as in use more than one, even if it's at night. Secondly, yes, you do get different flows. You get sort of like the light, the medium, and the heavier flow. But if you have to change your product more than twice, or at least in less than 2 to 4 hours, that is too much. Clotting actually is not a bad thing, provided you're not changing as often. Your blood or your body is supposed to clot because that's what prevents your body from bleeding out continuously. So when you do see clots, it's actually a good thing. When it's not a good thing is when you've got big clots and you're having to change your sanitary product too often. Yay? Yes, I'll take questions in between. I've got some questions here which were sent to us, but if you've got a question, stick your hand up and we'll do it in between. Happiness? Yes, ma'am. There was a hand there. Yes. A big clot. So actually what is considered a normal amount of period, surprisingly enough, is about 80 meals throughout your whole cycle. But how many of us girls know that I bleed more than 80 meals in 3-4 days of my cycle, right? If you are concerned, especially like I said, if you're changing too often, if you are finding that you're getting tired as a result of anemia because you're losing too much blood throughout your cycles, please don't be that girl who's like, you know, my aunts and my grandmothers were like this. No, it is not okay to bleed for more than 7 days or to change your sanitary product that often. Yay? Yes, ma'am.
At what point do you need to start being concerned about your period pains? Because sometimes I vomit, and it's like the last time I thought, let me call the paramedics because it's going down.
Okay.
And it's just for one day.
Yeah. So here's the thing. 70% of women will experience what we call premenstrual cramps or premenstrual syndrome, and it is common, but it's not normal. Pain is not normal. And as women, can we throw away the Mbogoto vibes, right? Can we be marshmallows? Can we be princesses and stuff? If you are in pain and anything that interferes with your quality of life. So when you are unable to do what you need to do, it's not okay anymore, right? Sometimes it is because we're not maybe taking the right pain medication. I'll come to that. Sometimes it is because it's a thing that is in the genetics. Even if it is in the genetics, it still means you need to go get a healthcare professional to prescribe something that works well for you. Yes? That's a very good one. Does stress contribute to the kind of menstrual cramps you get? 100% yes. There is a chemical called prostaglandin. It's basically what gets released by your body, and it makes your uterus to contract or your womb to contract. And all that does is it's meant to just shed the lining of your womb, which is what your period is. But when you are more stressed, more of that chemical is actually pumped out, which means instead of your uterus doing this, it's doing this, which causes you more pain. So we are cyclical beings as women. We are not like men who kind of have this linear production of testosterone. They get that bout in the morning. That's why they have that morning erection in the mornings. But for us, we are cyclical. You'll find from day one. So day one, again, on your periods. Day one of your period is that first day of your period or day one of your cycle. you're bleeding anything between 1 to 7 days. Then you get to day 15, that's when you're ovulating, you're on top of everything. Your hormones are nice, your skin is popping, you are bright and shiny at work, you go home, you're on top of him or her, everything is good. Then about 7 to 10 days afterwards, you start going into that premenstrual phase, which then all your hormones start to drop. You start getting a peak of the progesterone first, and then everything starts to drop. So this is where the 70% of us kind of land. Some people have mood swings, some people have tender breast. That thing he was doing last week that was nice, this week is like, ungasayenzi. It's important to understand. I always say, if you can, I know sometimes we have to work, we've got stuff to do, but when you understand your menstrual cycle, you can anticipate yourself, you can plan even your calendar accordingly. Don't plan the biggest playground things on your PMS. Yorika, I hope you're not. On your PMS, right? If you can, that time should be a time where you are toned down, you are focusing on yourself, you are doing a lot of self-care, and I see they've given us some very nice self-care products here. They are in your goodie bags, I believe, so we'll check those out. Can I move on from menstrual health, time-wise?
Thank you so much. So in my case, I get my period from the morning till the evening, but during sleep, there's nothing.
Right.
What's that?
Does it happen?
Is it
And then the
normal?
following day, do you then get the period?
It's normal. So I get it for my full 3-4 days,
Right.
but at night, there's nothing.
You're just a lucky girl at night. You here's the thing. You get to do other things during the night. You don't get a break. You continue doing other nice things. Right. Can we talk contraception quickly? Right. Do you know that you can go to any clinic, pharmacy, and it's not just about promoting. Not everybody has access to a gynecologist. Not everybody has time to go and queue up at a clinic. And what we have, which is really great when it comes to pharmacies and clinics, is that they are in our malls, they are in our workspaces. Do you know that you can go and get your contraception from a clinic? Yes? Who goes and gets it there? Do you know that you don't need a prescription for an emergency contraception? What is an emergency contraception? Morning after? Yeah. Yes? Yeah, it's the morning after. The emergency pill. You don't need a script to go and get that. If you have had an oopsie, we're always promoting sexual health. Know your partner, understand what's going on with them. Also, make sure you're using a reliable contraceptive. But let us be honest, life happens. Sometimes in that situationship or the condom does things and you land with a potential unwanted pregnancy. In the first 72 hours, the earlier the better, you can go to a pharmacy and get a morning after pill. Common question I get is, can you use the morning after pill over and over in 1 month? And what was that? Say it louder. No. Why not? Anybody? Why not? It's not a reliable contraceptive. And also with the morning after, because you take 1 or 2 doses, depending on which one you're getting, it's a high concentration of hormones, which has a likelihood of really disturbing your cycle. That means you are no longer able to count properly if you're using it more than once. And if you actually need it at least more than twice in 1 month, it means you are ready for a reliable contraceptive. And can I just say this, guys? Pull-out game is not a... Do you understand how many people rely on pull-out game, right? Don't say hi, because me, I see it all the time, right? It is the least reliable. 25 out of 100 women per year will fall pregnant on pull-out. Do we need to go on the other efficacies of other contraceptives? Any other questions on contraception? I want to get to some other nice stuff and take more questions.
Hi, can you just give us the risk of using those stuff? Because I heard that you can get a tumor from them.
Sorry, say that again.
I heard that you can get a tumor from them. Can you just give us
A tumor from
from the
contraception.
Yes.
Okay, let me do a quick breakdown in terms of what do we have as contraception. Contraceptives, you get those that are available in public health, but even if you are in a public health setting, if you don't want what they have available there, you can get the doctor there to prescribe or the nurse to prescribe, and you can get whichever one you would like, even from a private pharmacy. So just because you went to a public facility doesn't mean you have to utilize what they have. A lot of people often end up with like the injectables, Depo-Provera or Naristorate, or from the pill, the Triphasal, which is predominantly in our public sector. And I'll be the first one to say that Depo-Provera, if it works for you, great. But if you are thinking about a contraceptive, it's not my first go-to. Now, if you think of the two categories, you get what we call the hormonal and the non-hormonal. The non-hormonal means that they work by another method, but not hormones in the contraceptive. And there is one particular one, which is the loop, or what we call an intrauterine device. It sits inside the uterus. It works directly on the actual lining of the womb. It's copper-based. When it comes to the hormonal contraceptives, even within hormonal, you get two. You get the ones with two hormones, progestin and estrogen, and you get the one with just one hormone. Okay, now let's go to the one with two. Which ones are those? So all your pills, okay, there is one that's only got the progestin only, but most of your pills are two, or what we call a combined oral contraceptive. There are different versions of it. The one thing that is common for all of them is the estrogen in them. What changes, what we often change is the progestin, but also we can change in how sometimes they give you a little bit more hormone in the beginning of the cycle, a little bit less. So the combinations. If you look at them, you find people, for example, who want to use combined contraceptive for skin. So those ones have got a bit more estrogen. The ones that don't have that skin thing are more progestogenic, right? So the pill is the one, the patch is the other one, it's got combined. There's the ring. Anybody ever seen the ring? The ring you use monthly, right? There's the ring as well. It's also used, it's got two hormones in it. Then of the ones that have only just one hormone, you get the Microval, oh gosh, names. You get the one where generally if you're breastfeeding or post-delivery, we give you that for the first 4 months. Then you've got the injectables, the 2 monthly and the 3 monthly. Then you have what we call the intrauterine devices, which is the loop again. Guys, there's no such a thing as a baby will come out holding the loop like this. Like, please, accurate information. So when you look at it in terms of what is most reliable in their order, right at the top, you've got obviously the vasectomy and the bilateral tubal ligation. Those are irreversible or not reversible. If you have not completed your family, don't go there, right? Yes, we as gynaes or as urologists, we may, if we need to, try and reverse, but it's a worse off kind of operation to do. So only if you have completed your family, you are sure, I never want to have kids, then you can tie your tubes as a lady, or a vasectomy for guys. And for guys, just because you've had a vasectomy, you'll still have a great erection, you'll still have great ejaculation. It doesn't interfere with your sex drive in any way. And in fact, if you have to pick between a vasectomy and a tubal ligation, the vasectomy is a much lighter operation than the other one. Yay? Then, after that, after the tubal ligation, I got you, noted. After the tubal ligation, you've got what you call the long-term or the long-acting reversible contraceptive. That is your intrauterine device that I spoke about, whether it's got hormones or not. Intrauterine, that's one of the top. Then you get the implants, the ones that go in here, right, that are also right at the top, as well as then you get your injectables. After that, so those ones, you have about a 1 to 2 chances of falling pregnant per year per 100 women. Then you get to the pill. The pill is sitting at 9 women per 100. So you can see which one, as we get down the list, you start losing the efficacy. But I want you to understand this. Particularly something like the pill. The reason why a lot of the times it doesn't work as well as it's supposed to is because of us. How many of us can remember to take it every day at the same time? And what happens when we've skipped one, then we take two the next day, and then we have antibiotics, and then we drink a bit of alcohol and we forget, right? So the efficacy of every contraceptive generally relies on us using them correctly. Use it accurately and things go fine. Then, so I said you've got the pill. Then after the pill, you get what we call the natural method. Some people use the calendar where they say, okay, I know my cycle. During ovulation, we are not going to be intimate. Right? The other one is lactation methods. People often ask, if I'm breastfeeding, will I fall pregnant? And I want to warn you, for breastfeeding to work, first of all, it has to be in the first 6 months of post-delivery. Secondly, you have to be exclusively breastfeeding. As soon as you start giving your child anything else, whether it's bottled milk or formula milk, or you start introducing solids, it's no longer reliable. Once you start having your period regularly, be wary. If you don't want to be a 2 under 2, get something more reliable. And then the other sort of like natural method, we've spoken about pull-out method. 25% out of 100 will fall pregnant on pull-out. Don't do it. Unless you're trying to fall pregnant. Right, any questions there?
Thank you. I'm on HRT, hormone replacement therapy, and then I've been told there's high chances of getting breast cancer. How true is that?
Right. How old are you, ma'am, if you don't mind me asking? 49, right. So the next topic I want to... Is that a question? Okay, there's a question there, noted. So the next question I wanted to run into, we'll come back maybe to a little bit of pregnancy and things, but let's jump on to menopause. After my 40-something. Right? So menopause goes hand in hand with perimenopause, actually. And very often we don't understand, nobody speaks about the perimenopausal phase. So from 35 years of age, let me start here. As women, we are born with all our eggs in the beginning. So when you are born in your mother's womb, even still, all your eggs are already within you. When you are born, you're born with all your eggs, and they start to die over the years. You get a big bout that dies before you start puberty, and then from puberty onwards, you start losing. So in a cycle, when you start your period, you should be losing about 5 to 8 every single month, right? You are born with about 500,000 or so you've got enough to get you to the other side. But one of the important things about your ovaries is that they produce estrogen, which is the nice hormone that gives us sort of like our nice skin, that gives us the bright mood, that gives us our libido or sex drive, that gives us our curves and make us look nicer than the boys, right? But as we get to 35, the amount, the quality, and the quantity of those eggs starts to decline rapidly, which means that estrogen starts to decline as well. What does that do? We start losing hair, our skin starts being a bit more dry, our libido starts to decline, our brains become foggy, our bones and muscles start to suffer, and no matter how much gym you do, you find that you just can't get that little fupa out of the way, right? So these are all the effects of that declining testosterone as well as your estrogen. She spoke, sorry, can I get your name? Bule. Bule asked, she's 49 years of age, she's on HRT, and is there a risk of HRT causing breast cancer? Now, what is HRT? HRT is hormone replacement therapy. A lot of people, a lot of women are very scared of the idea of taking hormone replacement therapy because of the breast cancer scare. I want to assure you, first and foremost, if you are experiencing menopausal symptoms, which may include, like I said, you can have fogginess of head, forgetfulness. The big one is hot flashes, drying, what we call genitourinary symptoms, where you get dryness, you are more prone to UTIs, dryness during sexual intimacy, and all of these things very often affect your quality of life, if it's bothering you, please see a healthcare provider. Hormone replacement therapy has to be individualized, because if you've got a family history of breast cancer, we might be able to say, maybe not hormone replacement, let's try something else. And hormone replacement therapy is not the only thing that we have available in these days and in this day and age. So the big thing that we worry about in terms of breast cancer and hormone replacement therapy is the estrogen in your hormone replacement, which is actually the real thing that you need to get the symptoms better. But it's not the only thing we can use. So if there are any contraindications based on your own history and medical conditions or underlying medical conditions, we can always tailor-make your treatment to suit your symptoms, but also your medical profile. Yay? You can chat to me afterwards if need be. Anything else on menopause? Yes, sir. You.
Hi. It's not about menopause. I just want to ask a question
Yes.
about vasectomy.
Yes, sir.
Is it reversible?
Is it reversible?
Yes.
So, in a true sense, it is reversible, but because it's what we call microsurgery, there are so many things that could go wrong. We don't advise anybody who still wants to have children to do a vasectomy. So as it stands, either than a condom or barrier method for men, that's about the only contraceptive we have. But that doesn't mean guys can't get involved in contraceptives. Make sure your girl is okay, or if it's a girl, make sure your girl is okay. Count the calendar with them. If they're taking a pill, remind them, be part and parcel of the conversation. It is much more effective when the partner is in the conversation and part of what is happening.
Okay, Doc, can I ask something again?
Yes.
So, in terms of contraceptives, the patch, is it effective?
It's very effective. If you use it accordingly as you should be, it actually has the similar efficacy as the pill. We've got 5 minutes. I want you to ask the most burning questions, especially if they have to do with sexual health and pleasure. How do men get to know where the G-spot is? Okay. Ladies, do you know where your G-spot is? Yes? No? Right, let's start here. How many holes do we have as girls? How many holes? We've got 3 minutes. Let's go. 3, 7. Somebody has been reading. Right, we've got 7. We've got 7. Let's go through it quickly. You've got the 3 visible ones, which is the one for the P, which is the urethra. You've got the vagina, which is where blood comes out, where things go in. And then you've got the anus, which is the back. But on either side of the urethra or the P one, you've got what you call skin glands on either side. You see when he touches you nice and you start feeling a little bit like... That sticky white fluid comes from those 2 holes on either side. And the vagina itself, on either side, you've got what you call the Bartholin's one. So when you're trying to find where the G-spot is, if you close your eyes and you put your 2 fingers in at the roof here, who speaks Zulu here? You know tripe? You know the towel-like part of the tripe? That's what it feels like. It's like it's got little A's if you... That's exactly where it is. But what it is, the G-spot, we think it's some mysterious thing. All the G-spot is actually the 90% of the clitoris that you see at the top. And it is as big as a penis. It's got 8,000 nerves. It was only created for pleasure. So please use it. Don't abuse it. Please use it. Right? So that is how you would find your G-spot. Any other questions? 1 minute left. Yes, ma'am.
Hi. Okay, this is a little bit awkward because my mom's sitting here, but I hope she's gonna understand. I just wanted to find out: is squirting during intercourse, is that normal, healthy? Does it affect you in any sort of way?
Oh, I'm so glad you asked. So remember those 7 holes? So remember the top 2 on either side of the pee hole? You'll get guys saying, yo, I made a squirt, the whole bed was wet. It's just pee. It's literally just pee. In fact, if he is stimulating that area, the G spot or the G zone, the bladder is right there as well. So if your bladder is full, so don't let anybody fool you. So real true squirt fluid, it's actually similar to semen that comes out from the males, and it's that sticky amount, and it can never be anything more than about 20 to 30 mils. It's a little bit. If the bed is wet, for real, for real. One more, one last one. 20 seconds, 15. Anybody? Guys, please do check out the Clicks website. There is so much information that we contribute around these topics. Or you can go to our website as well, or our social media at dr.gynae. I answer as many of these questions. We never have enough time. If you have any more, please send, and we will be able to answer. Thank you very much.
So much, Doc. So informative.
I just wanna have fun, clap my hands, turn around now and dance, dance, dance. I just wanna have fun, clap my hands, turn around now and dance, dance, dance. I just wanna have fun, clap my hands, turn around now and dance, dance, dance. I just wanna have fun, clap my hands, turn around now and dance, dance, dance. I just wanna have fun, clap my hands, turn around now.